Well, we're going to go ahead and get started. For those of you who do not know me, my name is Christopher Cervantes. I am the Vice President of Human Resources here with Medical Home Team. Today we're going to be going over the components that I cover in regards to your orientation. These will consist of the employee handbook and your benefits. So if you would, please keep all questions till the end, and we'll get started, okay? The first document that we're going to be covering will be the Employee Benefits Guide for 2014-2015. This document contains everything in regards to your medical, dental, and vision, as well as your free benefits, which we'll be covering as well. So if you'll turn to the third page, which is page 1, it'll be your table of contents. It'll give you a synopsis of the items contained within regarding the different sections. So if you need to look at a specific area, such as, let's say, life insurance, it'll be listed there, and you can simply go to that page. Okay? If you go to the second page, it'll be the welcome statement. It'll also provide information on who is eligible. Everyone here in attendance today is eligible, as you are full-time employees working more than 32 hours in a given week. As far as the eligibility and effective dates, you are eligible for your insurance to start, if you so choose, first of the month after a full calendar waiting period. So everyone's hire date was the 27th. Therefore, your insurance will kick in 11/1, okay, as you make your elections. All right. The next page will cover what we call status change events, qualified family status changes. These can be anything from, birth of a child to add that dependent to your insurance, loss of previous coverage and or current coverage and needing to enroll in the coverage that we provide to you, and so on and so forth as they are listed. There is a 30-day limit from the date of event. So let's say if you happen to get married and you want to add your spouse to your insurance, you have 30 days from the date of that marriage in order to get that individual added. Same thing with the birth of the child. From the date of birth of that child, you have 30 days in order to get the information to us in order to add that child to your coverage. Okay? All right. If you go to page 4, this will be contact information for all our vendors in regards to the insurance themselves. We have 2 vendors. Guardian handles your dental, vision, life insurance, short-term and long-term disability coverages. Blue Cross Blue Shield of Texas currently handles your medical and your prescription drug plan. The corresponding numbers for each area are provided along with website information. And so if you have any questions that I cannot answer for you, you can definitely get in contact with those providers in order to get the resolutions for you. Okay? All right, if you go to the next page, you'll have your medical and prescription drug plan provided to you by Blue Cross and Blue Shield. This will be in a column format. At the top, you'll see the benefit plan. We have 2, the RS-14 and the RS-04. I will tell you that these plans are identical in coverage except for 2 aspects, actually 3 aspects, I should say. One, obviously, is going to be the deductibles for the individual and or family. The other aspects will be the out-of-pocket maximums associated with both in-network and out-of-network procedures in coverage. On the RS-14, which is the cheaper of the 2 plans, your individual in-network and out-of-network deductible is $1,500. For family, it's $4,500. Okay. In regards to your out-of-pocket maximums, in-network, it's $4,500 and for individual and $13,500 for family. Out-of-network, it's $7,500 for individual and $22,500 for family. On the RS-04, the deductible is reduced in network and out-of-network to $500 per individual, or individual, I should say, and $1,500 family. Your out-of-pocket maximums are also reduced to in-network being $3,000 for individual and $9,000 for family. The out-of-network correspondence of out-of-pocket maximums is $5,500 for individual and $16,500 for family. Aside from that, both plans have coinsurance of 80/20 in network, 60/40 out of network. You also have your primary care copays, specialist care copays, urgent care listings, and so on and so forth. If you pay particular attention to the bottom, you'll see the retail pharmacy, tier 1, 2, and 3. Tier 1 is generic. Tier 2 would typically be brand, and Tier 3 would be non-preferred. Those prices are associated as far as copays with your prescriptions. If you have certain prescriptions that you are on that are month-to-month aspects, you can have them mail ordered in 90-day increments, and we can get that addressed for you as well. If you have, let's say, insulin needs, if you want to ensure that your insulin that you take is covered under the insurance, by all means, address that with me one-off, and we'll get those questions answered for you. And that is in regards to any prescriptions or medications that you're taking. We can get all that resolved fairly quickly. At the bottom of the page, you'll see the employees' cost ratios in order of coverage. These are listed in pay period increments. So if you're looking for your monthly contributions for your medical components, you simply take the corresponding number and multiply it by 2. So for instance, if you wanted the RS-14 plan for employee only, and it's listed at $120.50 pay period, that comes out to $241 a month for your medical coverage, okay? All right. If we go to the next page, we will begin our dental coverage, which is provided by Guardian. There are 2 plans, the DHMO, which is the Managed Dental Guard, and our NAP plan, which is the Dental Card Preferred. Both plans have the same coverages as far as what's covered. They just have different breakdowns on how they're reimbursed and or provided for. The DHMO specifically is a network of providers that you'll actually have to pick a primary dentist office in your area in order to utilize that insurance. At no time could you have that insurance without electing one. You may be able to find one that's in your immediate area, but typically there are very few and far between. So you'll have to actually go on their website and put in your address and or your local zip code and select about a 20-mile radius to find one that's in your area. Okay. The Dental Card Preferred is obviously the PPO version. Every dentist I know takes that. It has a $1,500 maximum benefit allowance annually. You'll have a copay of $50 per visit, no more than 3 times. The office visit copay, there are none. Your preventative care, such as cleaning, fluoride treatments, oral exams, sealants, and x-rays are covered at 100%, which is your preventative care. Basic care, such as fillings, periodontal maintenance, simple extractions, are covered at 80%. Your major care, such as anesthesia, bridges, dentures, inlays, onlays, veneers, repairs and maintenance to the crowns, bridges, and dentures. Typically, those major care items are covered at 50%. So long as you have pre-approval, you'll always know exactly what's covered at what percentages and have a full understanding before you go through anything. Okay? On the DHMO side, it varies based on the dentist's office as far as the coverage. So you'll see a range of dollar amounts of what their contributions are towards those services. So just be aware of that, and you'll actually have to work with that specific provider, tell them what you're actually going to be going through, verify it with your insurance as far as what those rates will be if you happen to go with the DHMO. Okay? Now, at the bottom again, I said that the prices are listed in a pay period to pay period basis, so simply take the corresponding amount for the coverage in which you're choosing and multiply the number by 2 for the monthly amount. All right? Okay. Next, we'll go into vision. We have one provider for vision. It's the VSP network. I don't know any optometrist or vision specialist that does not take that. Everyone's pretty much in that network or at least affiliated with it in some way. So you do have in-network and non-network benefits with a vision plan. As far as your copays for the exams is $10 for materials is $25, but they'll be waived if you have lenses, things of that nature added to your care. Your service frequencies as far as your exams, lenses, and frames are every calendar year, except for the frames, which are every 2 years. Sample of services that are covered: eye exam, single vision lenses, bifocal lenses, and trifocal lenses. Frames, contact lenses that are elective or medically necessary. Cosmetic extras, they'll have some discounts in networks, and most times not in out of network. But that'll cover the vision aspects of it. Okay. And again, at the bottom, you'll have the rates associated with that plan. Simply multiply the corresponding number by 2 for your monthly amount. All right. Next, we'll get into the benefits that Medical Home Team provides to you at no charge. So under no obligation to you financially, these benefits are given to you, at no cost. Your basic life insurance, it's a $15,000 policy. It does have an AD&D associated with it, which is your accidental death and dismemberment. There is a benefit reduction based on your age, and you can see the corresponding information in that regard. And again, this is at no charge to you. Okay. In the bottom half of this section, you'll have the short-term and long-term disability, also provided by Guardian. Your short-term disability is an 11-week process, which is basically your first day of disability through your 90th day of disability. You'll receive a maximum of 60% of your salary, up to $1,000 per week. Upon your disability continuing past the 90th day, you'll be put into long-term disability, which covers the 91st day all the way up to age 65, or as the standard ADEA. Under long-term disability, you'll receive 60% of your salary to a maximum of $6,000 monthly. Okay? All right. And again, these benefits are at no charge to you. Okay? Wonderful. All right. Following that section, you'll be provided important annual notices, disclaimers regarding Medicare coverage, HIPAA compliance in order to maintain all your confidentiality of information, all that wonderful thing. So that's for you to read through. If you have any questions or concerns in those regards, please feel free to direct those to the HR department, and we'll have those rectified for you immediately. Okay? And that will cover America's Medical Home Team Employee Benefits Enrollment Guide. All right? Okay. The enrollment forms are also in the back of this document. That will begin on the last 6 pages, if you will. You'll have the enrollment forms for Blue Cross Blue Shield. Section 2 will be the most pertinent to you. It'll be all your personal information, your start dates, addresses, things of that nature. Section 3 will cover your elections. So if you're choosing the RS-14 or the RS-04, you'll simply circle the corresponding section, and then to the right of that, you'll elect who is covered, whether it be employee only, employee and spouse, employee and child and or children, or employee and family. If you are not electing coverage at this time, which is completely fine, simply elect the box that says, I am not applying for health care coverage. Okay? All right, Section 4 of the Blue Cross Blue Shield enrollment form. You will have your dependent information, such as your spouse and or dependent child and or children. Be sure to fill out the corresponding information, and so we can get those individuals properly enrolled. Okay? If you turn on the back of that, or turn the next page, you'll see Section 5, which does not apply. Section 6, in regards to disabled dependents, that may apply, so if that does, please provide that information as it is requested. If you have other coverage that you are maintaining and or keeping as far as co-insurance, please provide that information in Section 7. Section 8, if you happen to have Medicare coverage, feel free to put that information in as well. Section 9 is the declination of coverage. So if you are determining or making a decision not to elect benefit coverage at this time, please ensure that the information that it's requesting regarding yourself and your dependents is properly noted in that section. Once you've completed all the appropriate sections of this document, Section 10 is your signature and date. Okay? On the next section, you'll have the Guardian enrollments. This will cover your enrollments in relation to your vision, your dental, and all your free amenities provided to you by MHT, such as the life insurance policy, short-term and long-term disability. So on the first page, you'll have About You, which will be all your pertinent information, followed by About Your Job, how many hours you work per week, which is 40, your job title, your work status will be active, your date of full-time hire will be as of this Monday, and your annual salary. So if you need any assistance with any of that corresponding data, feel free to reach out to your direct report and or your HR department. We'll be happy to get that for you. The bottom section is in relation to your dependents and or spouse. And if you're adding them to any of the coverages such as dental and or vision, please provide their corresponding information so they can be enrolled. Okay. On the next page, you'll actually have the election page. It'll actually be the bottom two sections. For dental coverage, you'll have two options, the DHMO and the PPO. Please fill in the corresponding box for either employee and only, employee and spouse, employee and child and or children, or employee and family. If you are not electing dental coverage at this time, please fill out the proper corresponding boxes at the bottom of that section and the reasons as to why. Beneath that section, you'll have the vision coverage where there's only one aspect, the VSP. You'll simply make your election of who is covered, employee only through employee and family. And if you are not electing vision at this time, please make those adjustments and elections as necessary in that section as well. Okay. In regards to your basic life insurance, you are requested to have a primary and a contingent beneficiary listed. These can be multiples, so if you'd like to have two individuals or more as primary, simply list their names, their relation to you, and the percentages that you would like them allocated to. They do not have to be equal. You can have them at 50% in each one, 33 in all three of them, or 60-40, 80-20, however you like. Just so long as the totality is 100% between the individuals, that'll be fine. The contingent beneficiary is the individuals that will be allocated if the primary beneficiaries are unable to lay claim to your life insurance policy, so make sure that section's filled out as well. Okay? All right, short-term disability and long-term disability are already pre-checked because they're provided to you and completed. If you go to the next page, you'll have the signature page at the top, which requires your signature and date. Okay? All right, and that will cover the enrollment forms contained in the enrollment guide. Wonderful. Okay, the next document we're going to go to is 401k, which is provided by MassMutual. You are eligible for 401k enrollment after 90 days of employment. So I will be the first to tell you I am not a 401k expert. I do, however, have contacts within MassMutual that are representatives of MHT that can assist you in developing your portfolio, defining your needs and wants in your 401k desires. So if those individuals are looking for an aggressive growth, they'll be able to assist in that. If you're looking to just put away somebody in a safe and secure location with little or no risk, they'll be able to assist with that as well. Okay? But what we will do is we will cover the enrollment forms. If you open the book to page 3, which should be the first page, or the second, I should say, you'll have the basic enrollment form, which will have section A, the plan information, which will be provided by us, already pre-filled. Section B will be the employee information. This will contain all your pertinent information such as social security number, address, name, date of birth, things of that nature. Section C is your contribution of election. Here you'll make your contribution allocations in percentage format only. They do not take dollar amounts. So let's say, for instance, if you wanted to contribute, let's say, $100 a pay period and you make $1,000 a pay period, you would allocate 10%. That'd be your $100. Okay, you can have that submitted in a pre-tax method and or after-tax method, which is the Roth after-tax. So in essence, if you're contributing on a pre-tax basis, you'll be paying taxes on removal of such funds, at that time. If you have them put in after-tax, Roth after-tax, you will not be subject to taxes when they are removed in the appropriate time. Now, if they are early, then you will have to. But at the close of your 401k, you won't be taxed. And if you have any questions or concerns regarding those aspects, feel free to contact the HR department. We'll be more than happy to get that information to you. Okay? All right. On the back side of that page, page 4, section D, this will be your portfolio. And like I said, this is a very large document, and it will not make complete sense at this time. But once we get through the entire document, you'll have a better understanding of what each section implies and the risk associated with them, whether it be low risk, mid-risk, or high risk. Okay? And then once you make your elections as your, with your portfolio, which you'll have assistance with, just make sure that the ones that you allocate to are totality and 100%. So if you elect 4, you can split it up, 25% in each one, 70% in one, and then 10% in the other 3. So long as it's 100%, it'll be completely fine. Once you've made those elections, in section E, you'll have your signature and date, which will be required in order to process. Your 401k benefits, such as elections, as far as the percentages that you're contributing, as well as the portfolio that you have created, are not binding. So you can change them at any time. Unlike your medical, dental, and vision insurance, you can't get out of that unless you have a qualifying event. But in regards to your 401k, you can turn it off, turn it on at your leisure. You can change the amount of your contribution. You can change your portfolio at any time. It does take a full payroll cycle for those changes to take effect, though. Okay? Wonderful. Okay. The next section on page 7, you'll have your beneficiary designation forms. This is different from your life insurance policy, so the forms will need to be completed. Now, they can mirror your life insurance policy if you so choose, or they can be different. It's entirely at your discretion. So just make sure that those forms are completed in their entirety with the primary beneficiaries and the contingent beneficiaries, and have that submitted to the HR department. Okay? All right. If you currently have 401ks, or a 401k, I should say, and decide to roll them over to MassMutual, there are forms here allocated for that purposes. If you need any assistance, which I'm sure you will, feel free to contact the HR department, and we'll be able to get that processed for you. Okay. All right. The rest of the document will cover the plan highlights. Feel free to read through that at your leisure. It's a lot of information, most of which will be very difficult to understand. I would like to set up appointments with you, or for you, I should say, with MassMutual representatives in order to get a firm understanding of your portfolio, what it entails, and how the best it suits your needs. Okay? So that's definitely a conversation we'll need to have in the next 2 to 3 months, if you so choose to enroll in the 401k. Currently, the 401k does not have an employer match. We are reevaluating that, looking towards 2016 in order to having one, but at this current time we do not. All right, and that will cover your 401k plan provided to you by MassMutual. All right, the next document and the final document that we'll be covering today will be the employee handbook and policies and procedures. This document should be one of the first sources that you go to in regards to any questions and or concerns regarding anything that you should encounter here at MHT while an employee, or even after being an employee. If you go to the first page, it'll begin the table of contents, which you can see is very lengthy. It's about 3.5 pages long. It will cover everything from benefits themselves, HIPAA compliance, payroll, what you can expect as far as overtime, pay periods, filing complaints, grievances, progressive discipline, travel expense reimbursements. It's very, very inclusive of a lot of information. So we'll be going over a majority of this document today, not all of it. But please, over the next 3 to 4 days, make sure you familiarize yourself with it entirely. And then in the back of the document, there'll be an acknowledgement page that you'll need to return back to the HR department, acknowledging that you've been made aware of all policies and procedures contained herein. Okay? All right. If we go to page 7, we want to welcome you to Medical Home Team. With your help, together we can make a difference in the lives of those who depend upon us to provide them with care, support, and assistance in their daily activities. We encourage you to strive to always provide the best customer service possible and to represent Medical Home Team well. We hope that you will find your job both challenging and rewarding, and that you will share with us in success of our company. About your employee handbook. This employee handbook has been developed to help you understand our expectations, policies, and procedures so that you and all MHT employees may be able to successfully and satisfy you in your chosen careers. The contents of the employee handbook summarize present programs, policies, and procedures and are presented as guidelines to employees and managers. Employees should be aware that from time to time these policies may change, amend, added to, or deleted, except for the policy of at-will employment. As such, the contents of this employee handbook does not constitute the terms and conditions of contract of employment. The policies contained in the employee handbook are not intended to supersede any federal, state, or local laws. In cases where policies are in conflict with state or local laws, the applicable laws will prevail. Okay. And in regards to any amendments and or changes to the employee handbook, those will be provided to employees prior to their effective dates. So any changes, like I said, you'll be made aware of either by writing, your supervisor, or I should say in writing and by your supervisor, that you'll have to sign off and acknowledge to prior to their effective dates. Okay? All right. Okay, if we go to page 9, we'll cover two very, very important sections, such as one being the Code of Ethics. Medical Home Team employees will follow the following Code of Ethics. Provide compassionate and competent patient care. Respect human dignity, patient rights, colleagues, and their healthcare professionals. Safeguard and uphold patient confidentiality and privacy at all times and within constraints of the law. Promote better patient outcomes and performance by continuous monitoring through compliance and quality assurance. Regard care of patient as paramount. Prescribe patient medication in accordance with the standards of practice or after a home visit to confirm the need of the medication or treatment. Demonstrate honesty and professionalism in all interactions. Uphold the medical profession's standard of practice. Respect and uphold HIPAA guidelines. Remain cognizant of the risk areas of the practice. Identify and address the following risk areas. Proper coding and billing, ensuring that medical services are based upon medical necessity. Document according to the 1997 Medicare guidelines through an electronic medical record system. Avoid improper kickbacks, self-referrals, and inducements. Become aware of any staff member who are engaged in fraud, kickbacks, or deception, and report such activities to the compliance and or privacy officer. Handle and use company property efficiently and responsibly. Follow Medical Home Team policy and procedures. Report suspected violations or actual violations of law or company policies and procedures to the compliance and or privacy officer. Direct complaints to the Quality Assurance Committee and provide a reply within 7 days. Refer disputes, if unable to settle, to an independent medical party. Okay. Code of Conduct. The Medical Home Team will implement fair and effective policies and procedures to employ people on the basis of their qualifications with the assurance of equal opportunity and treatment regardless of race, religion, color, sex, age, national origin, veteran status, or handicap. To provide salaries and employee benefits which bear a fair and reasonable relationship to the work performed. To establish reasonable hours of work. To maintain a working environment that is safe, healthful, and free of harassment. And to actively encourage constructive suggestions that relate to methods, procedures, working conditions, and the nature of the work performed. Medical Home Team expects all employees to work productively and to the best of their abilities and skills, to arrive at their assigned work areas and begin work on time, to demonstrate a considerate, friendly, and constructive attitude to fellow employees, patients, clients, and visitors, and to adhere to the policies and procedures adopted by the HCDA. Medical Home Team retains the right to assign, supervise, discipline, and dismiss employees at any time, and to determine and change working hours and schedules, established, change, and delete its policies and procedures as necessary. All right. All right, we've already covered that. I should have marked these. Okay, if we go to page 15, your personal records section. MHT maintains certain records for each employee which is directly related to employees' positions within the company. The procedure: each employee's personnel file will contain the information that is needed to or by MHT to conduct its business or is required by federal, state, and local law. This information will be included job application forms, payroll information, salary changes, position changes, performance appraisals, disciplinary records, benefit eligibility and records, attendance records, education and training records, your actual benefit enrollment forms, medical information, accident reports, reference checks, things of such, will be kept in a separate and confidential file. Okay, so a little more information about your personnel file. Your personnel files are actually held in the HR department. There are only certain individuals or entities that have access to them, one being the employee themselves. If you want to review your employee file at any time, simply make that request to the HR department and we can set up an appointment for you to review that document. The other individuals, or individual I should say, that would have access to your HR file will be your direct report, such as your manager and/or supervisor. Under no other circumstances does anyone have access to your HR documentation. It's all confidential, locked away, no one can get to it. If a third party happens to need information out of your HR documents, such as dates of employment, salary, title, things of that nature, in order to provide that information to any third party, we would need written authorization from you to provide said information. So if you're applying for a loan, getting an apartment, things of such, that information will have to be authorized in order to be provided. Okay? All right. So that covers the employee's rights to privacy. And then we will go to training expenses, paid pairs, overtime work. All right. Okay, if we go to page 35. Hours of business and days off. To ensure the continuity of operations and the availability to meet patient needs, Medical Home Team provides service 24 hours a day, 7 days a week. Office hours are from 8 a.m. to 5 p.m. Monday through Friday. Medical staff makes visits 5 days a week or as patient needs indicate. Practitioners are not on call 24 hours a day, with a nurse taking the first call for triage. So as nurse practitioners, you do have a full support staff here on site that take calls from patients. Typically that will be scheduling flash visits as necessary, directing them to ER if necessary, and at no time should you actually take calls. You're not really on call 24 hours a day, but at some point in time, very, very infrequently and very, very rare will you ever be contacted after hours. Okay, just to make that clear. Okay, in regards to punctuality, employees will report on time to their scheduled work areas. Tardy employees will be subject to normal disciplinary procedures. So when making appointments, scheduling with patients, if you're running late or if you're running early, please give them a head warning. Constant communication is what we're really after in relation to meeting the patient needs and making sure that they're fully understanding of what's going on and when they can expect you. Okay. All right. You go to page 38. In regards to inclement weather, employees are expected to make a good faith effort to get to work during inclement weather and conditions. If the company or practice is operating and does not declare an emergency closing, those employees who are unable to get to work under these conditions will be granted an authorized but an unpaid leave of absence if they notify their supervisor. Okay. In relation to inclement weather, we are a national company. The weather is not always great all over the United States. So if you are in bad weather in your area, there's upcoming storms, tornadoes, hurricanes, God knows what it could be. But if it's something preemptive that you have 2 or 3 days notification of that's coming, please inform your managers of that situation that may arise. If it's a flash, immediate weather condition, please notify your manager of the current situation and they'll evaluate based on that need. Typically what will happen is the patients will be contacted, obviously, making sure that they are rescheduled and making sure they have all their medical needs such as prescriptions, things of such, to hold them through until they can be seen after the inclement weather conditions subside. Okay. In regards to requests for time off, everyone will be emailed and provided the employee PTO request form. These forms need to be submitted to your direct report, hopefully within as much advance notice as possible. Typically, we ask for about 7 business days. It'd be great if we could have more. We do understand that things do arise on a moment-to-moment basis, so any and all preemptive warning to your direct report would be, ideal. Typically no less than 4 hours, hopefully. Okay. Holidays, we honor New Year's Day, Memorial Day, Independence Day, Labor Day, Thanksgiving Day, the day after Thanksgiving, and Christmas. These days are treated as holidays. They do not count towards your PTO bank and are paid just as a working day. If you do happen to be working on a holiday, typically if you're an hourly employee, that will be paid at an hourly time and a half rate. Okay? All right. We've already covered personal emergencies. All right. If we go to page 45, we will cover the confidentiality of information, and this will pertain to both patient and employee. Okay. Medical home team respects the privacy of its patients, employees, and company or practice. For this reason, the following policies have been established to assist employees in properly handling confidential information. The definitions of confidential refers to something private, something that is not to be shared or discussed with others. This specifically includes any information concerning a patient's condition, treatment, personal affairs, or records, current or former employee information, and proprietary information and confidential records of the company or practice. A breach of confidentiality refers to unofficial or unauthorized discussion or dissemination of confidential information outside the line of duty. All employees hired are required to attend HIPAA compliance training, which I know we've already done. In regards to confidentiality, your information is very confidential to the HR department. Patient information is very confidential. At no time should you ever be inclined to talk about patient information amongst your peers or anyone that's not authorized. This also pertains to employee information, such as information revolving around you, should that at no time be discussed with anyone inside or outside the organization. If you have any questions or concerns regarding what can be shared and what cannot be shared, given a basic topic, please direct that question to the HR department and or your direct report, and we'll be happy to give you information in that regard. Okay? All right. Okay, we go to page 55. Actually, excuse me, 54. Dress guidelines and personal appearance. As nurse practitioners, you'll be issued a company vehicle, which is completely wrapped in medical home team branding. It would be very, very difficult for you to go anywhere in that vehicle and not know who you are. This is, it serves a number of benefits. One, it's, good to let the public know that you're in the area. It's also very important that the patient sees who arrives and can identify that vehicle very, very easily. So they're put at ease who's arriving at their house. As far as dress guidelines go, it's always professional dress at all times. You will be provided lab coats, which bear the markings of MHT, and any other wardrobe necessities that you may have, such as scrubs, if need be, or things of such. So be sure to have all that on your person when conducting business. If you go to page 55, we'll cover identification badges. Individuals will be provided identification badges, which will have your picture, your full name, your title, and who you work for. This identification badge needs to be worn at all times when visiting patients and conducting business. Okay. Work area. Work area is a little unique for practitioners. Your vehicles, we would like for you to consider them basically mobile offices. They will have supplies in them in order to provide the quality of care that you will be providing, but they also need to be kept and maintained in a very cleanly fashion. Any maintenance regarding that vehicle, keeping it washed, clean, is completely all reimbursable, so please make sure that car is maintained at all times. Okay? Can't have it covered in mud and go into somebody's house and say, who was that? So just make sure that's well maintained and properly representing yourself as well as MHT. Okay, okay, we do need to cover one of those sections. In regards to the equipment, there's an equipment policy that we need to cover regarding your cell phones, hotspots, tablets, and or laptops if you happen to get one of those. I believe you'll probably only get tablets. But any and all equipment that's provided to you from the company needs to be utilized only for company business. At no time should you ever use your phone, your tablet to access anything other than work-related material. Do not go to Google, do not go to Yahoo, do not go to Facebook or anything of such. These items are tracked. They have devices on them that can basically map everything that transpires on them. So we see all web addresses, all documentation. So if you do need to visit personal information and or sites not associated with our organization, please use your personal devices such as your own cell phones, your own laptops and devices in order to access that. Do not use company material, okay? Company email, same perspective, use it and utilize it only for company business, contacting members within the organization and or work-related individuals. At no time should you have personal emails going in or through your company directory, okay? Are there any questions regarding the usage of the company property? Okay, good. All right, that will cover a majority of the employee handbook, and as I said, you'll need to spend the next 3 to 4 days going through it entirely. If you have any questions or concerns in any of the information that is contained within that document or the information that I have conveyed to you today, please feel free to contact your HR department and or your direct report, and we'll get those resolutions for you. Well, I want to thank everyone for attending orientation with me today, and if you have any questions and concerns, feel free to reach me at any time.